coming to Chalazion. Chalazion, it is also known as Meibomian cyst. Okay, it is a chronic non-suppurative lipogranulomatous inflammation of Meibomian gland. Okay, repeat with me: chronic non-suppurative lipogranulomatous inflammation of Meibomian gland. Okay, most commonly it occur as a lid lump. Okay, it most common occurs on upper eyelid. Etiology: predisposing factors are same as that of external hordeolum. Okay, what were the predisposing factors? It is more common in children's, and habitual rubbing of the eyes, fingering of the eyes, and most commonly in diabetes patient, and metabolic factors of the patients. Okay. Now coming to pathogenesis of Chalazion, low virulence organisms, that is low or mild grade infection of the Meibomian gland. On further proliferation of epithelium and infiltration of the duct walls. Okay, the duct, as there is proliferation of epithelium, the duct opening will get closed. Okay, and ducts get blocked. There will be retention of secretion or sebum in the gland. Therefore, the gland gets enlargement. That is gland enlargement. Pent up and extravated secretions are fatty in nature, act like irritant. Okay, cause of non-infectious lipogranulomatous inflammation of blocked meibomian gland and the surrounding tissue. Okay, initially what will happen? There will be normal meibomian gland, and because of low virulence organisms, they will get infection of the meibomian gland, which causes proliferation of epithelium, and the ducts get blocked, and the sebum and secretions get clogged inside the meibomian gland. The meibomian glands enlarged, and there will start irritation. Okay. Clinical features: symptoms: there is a painless swelling associated with the lid margin, with gradually increase in size. Okay, this is the main symptom: painless swelling which increases in size. There will be mild heaviness of the lid, which is of moderate to large chalazion. Okay, heaviness of the lid is seen. Other clinical features are: there will be blurred vision. Okay, due to induced astigmatism, large chalazion which provides pressure on the cornea. Okay, astigmatism means there will be two different focal points. Okay, next there will be watering, that is epiphoria, due to eversion of the lower punctum. Because of large chalazion, the lower eyelid get everted. Okay, now coming to the signs. Okay, what are the signs? There will be nodule which is away from the lid margin, which will be hard, non-tender on palpation, most commonly in the upper eyelid than the lower eyelid, because there will be number of meibomian glands in the upper eyelid is more than that of number of meibomian glands on the lower eyelid. Okay, in upper eyelid nearly 30 to 40 are there, in lower eyelid near 20 are there. Okay, there will be reddish or purple area where chalazion usually points. Okay, seen on the palpebral conjunctiva after eversion of the lid. Palpebral conjunctiva, you know, no? Like when you avert the upper eyelid, you can see palpebral conjunctiva. There will be projection or the main bulk of the swelling on the skin side. Okay, you can see outer swelling is from the outer side. Okay, marginal chalazion, there will be small reddish gray nodule on the lid margin. Now coming to the clinical course and complications. You can see there is complete spontaneous resolution in some of the cases. Okay, and in normal cases, there is slow increase in size of the chalazion, and then it will become very large. Okay, there will be fungating mass of a granulation tissue when less in burrows and conjunctival side. Okay, there is fungating mass of the granulation tissue. That's why it is lipogranulomatous inflammation. And there can be secondary inflammation which can lead to formation of hordeolum internum. Okay, and calcification in some of the rare cases, and malignant change can also be seen, that is meibomian gland adenocarcinoma, that is sebaceous cell carcinoma in elders. Okay, treatment: we will give conservative treatment. Okay, conservative treatment: small, soft and recurrent chalazion. We will give hot fermentation, topical antibiotic eye ointments, and oral anti-inflammatory drugs. Okay, next we will give intralesional long-acting steroids, that is triamcinolone, which in 50% of cases the chalazion get resolved. And in small, soft and recent onset chalazion near the puncta, if we do incision and drainage, which causes more damage. Okay, therefore we should not do incision and drainage in small, soft and recent chalazion. Now next is the incision and curettage. Incision and curettage, it is a conventional and effective treatment. Okay, done using chalazion scoop. Surface anesthesia is given, that is xylocaine 2%. Along with then we will give incision with help of a sharp blade on the posterior part of the conjunctiva. it should be vertical incision so that we can preserve the other glands, and on the skin side we will give horizontal incision so that we will give minimal scarring. Okay. And to avoid the recurrence, carbolic acid cautery is done and with neutralization with methylated spirit. After antibiotic eye ointment, then patching of the eye is done for 6 to 12 hours. Post-operative, we will give hot fermentation, antibiotic eye drops, oral anti-inflammatory drugs, analgesics and oral antibiotics. Okay. Remember, oral and topical antibiotics, anti-inflammatory and analgesics, hot fermentation. Diathermy is done with marginal chalazion. Oral tetracycline is given for prophylaxis of recurrent chalazion, and oral tetracycline also if it is given associated with acne rosacea or seborrheic dermatitis. So I will. This is the picture of a chalazion. You can see there is swelling in the upper eyelid. Okay, there is beautiful swelling, and it is swelling occurs on the skin side. The incision is given on the skin side is horizontal incision. Okay, horizontal incision is given on the skin side. Now you can see C-shape scoop is this is Chalazion scoop. Okay, here we will give vertical incision. Imagine this is the eyelid. Okay, the meibomian glands are arranged vertically like this. That's why vertical incision is given so that you can drain that meibomian gland. Okay, meibomian cyst. If we give horizontal incision, or you will cut the ducts of other meibomian gland. Okay. This is incision and curettage of Chalazion from the conjunctival side. That's it. Jai Hind, Jai Bharat.